Good morning, colleagues. Today's theme is male genital or reproductive organs. And first of all, I'd like to propose you questions for self-control, for self-testing. So, first question is seminiferous tracts, cords of the testes, cords of the content of the spermatic cord, parts of the male urethra, and sphincters of the male urethra. We shall discuss all these questions, but maybe in different order. The first question, the overview of male genital or reproductive organs. Here it is, the scheme. It could be similar to photo, but nevertheless it's scheme. Let's discuss each position. So number one, always in reproductive organs, both female and male, are the genital glands, because they are glands of both internal secretion and external secretion. So when we ask ourselves or anybody, what is the main sign of the gender, of the sex? The only one correct answer, the main sign of the gender is the reproductive gland. So in male it's testes, in female ovarium. So number one, testes, it's male gland. You can see that it is located not inside of the abdominal cavity, but externally, practically in special bag sac surnamed scrotum. So this is a depiction of scrotum, inside of which testes are located. This is a paired organ, so there are two of them, left and right. Sure, inside of the testes there are a lot of seminiferous tubules, and after they excrete the semen inside of the second structure, number two, epididymis. Epididymis. After, from epididymis, the semen is transported through number three structure. Number three is Ductus Deferens, special canal through which semen is transported from the scrotum into the urethra, into the canal which is common for urine and also for semen. So male urethra is a tubal structured organ which serves for two functions, for urination and for transporting of the semen. And number four is vesicula seminalis. Here it is. Vesicula seminalis contains a special fluid which make the spermatozoa more active, more motility. So this fluid mixed together with semen and forms the ejaculate. So number 5, here it is. It's small organ, very important, which called prostata or prostatic gland. It's interesting, this term prostata means that it is located ahead, that it's most important. This name is really a result of the function of prostate. It also activates spermatozoa and is very important organ in male organism. Then number 6, inside of prostata, of prostate, there is a special tubule in which we can find that Ductus Deferens number 3 and Ductus excretorius from vesicula seminalis, they have fusion. So number 6 is result of fusion of Ductus Deferens and Ductus ejaculatorius. Number 6 is Ductus Deferens and Ductus excretorius, and number 6 is Ductus ejaculatorius. So number 3 Ductus Deferens. Number 4 vesicula seminalis, through which the fluid is passed through Ductus excretorius, and fusion of Ductus excretorius and Ductus Deferens is number 6 Ductus ejaculatorius. It will be opened inside of this long structure, which is urethra, male urethra. But about this several minutes later. So number 7 in this picture is ureter. Be attentive that there are two similar according pronunciation term, but quite different. Ureter masculinum. This word is masculinum, but ureter has both male and female. Ureter masculinum, but inside of penis there is urethra. Urethra, this word is femininum. Nevertheless, again, there are urethra masculina and urethra feminina. So in male reproductive system, we can compare urether, number 7, and urethra, number 9. Then number 8, this is vesica urinaria. It's interesting that vesica urinaria here has a special, very elongated and shape part which called the apex of vesica urinaria. And here, close to prostate, this is fundus of vesica urinaria. So we can see here apex and fundus of vesica urinaria. Number 8, vesica urinaria. And number 9, corpus cavernosum penis. Now it's difficult to explain in detail. In penis there are 3 corpora, corpora cavernosa. One of them is here. They are paired, one and second. And corpus spongiosum. Corpus spongiosum, which is this widened part, and inside of which number 9 is urethra masculina. So before I said that number 9 is urethra masculina because it's difficult to distinguish the line, but let us say that it's urethra, this canal which connects vesico-urinaria and external environment. And number 10, the last structure which designated here, number 10, is glandula bulbo-urethralis, a special gland which prevent urethra, the mucus of urethra, from irritation by the urine, because urine is quite aggressive fluid, and to prevent the damage of mucus sheet of urethra serves glandula bulbo-urethralis. So this is common structure. And now it's interesting. We say that penis is external organ of genital system, but nevertheless testes and epididymis we discuss as internal organ. Why? Because testis was developed in intrauterine period of development very high in abdominal cavity, close to the kidneys, and then after 5th month of intrauterine development, testis has a process of descensus, of migration from this loin region externally. It forms during this process inguinal canal, and then we can say that scrotum is migrated part of abdominal cavity in external part of the body. Why it's necessary? It's interesting, but the temperature for spermatogenesis should be less than temperature of the body. That's why it's necessary to move the testes externally from the common body cavity. Next question. Parts of the male urethra. Parts of the male urethra. We shall use with you this horizontal section. Let's try to understand what it's drawn here. This is vesico-urinaria, section it horizontally. This is prostate, also section it. And this is penis, also section it in this plane, horizontal plane. So it's very important that male urethra is quite long, and it originates in the so-named neck of the vesica urinaria, here by the ostium urethrae internum. This is ostium urethrae internum. And it will be finished, it will be ends here in ostium urethrae externum. And it's quite enough long pathway for urination, about 10, 15 or more centimeters, which depends from constitution. About the parts of the urethra. First part of urethra is designated by this arrow, so-named Parse prostatica urethra. Why Parse prostatica? Because it's located inside of prostate. This is prostate, and we can see that through prostate, urethra passes, and this part names Parse prostatica urethra. Then next or second part is Pars membranacea urethra. Next arrow demonstrate as Pars membranacea urethra. Pars membranacea means that urethra penetrates some kind of membrane. It's muscular membrane together with fascias. We shall discuss the details of this muscle next lesson. And it's quite short part of urethra. Pars membranacea is not more than 1 centimeter, usually less, usually half of centimeter. And it's small distance between prostate part, pars prostatica, and the next part, which is inside of the penis. So this third and last part of urethra is pars spongiosa urethra. Spongiosa, it means inside of sponge. The penis consists of 3 quite similar to each other blood-containing organs, and central from these 3 parts of the penis has urinary canal, that means urethra. So it is called pars spongiosa urethra. This is corpus spongiosum, and pars spongiosa of urethra is inside of corpus spongiosum. So practically last point is ostium urethrae externum. It means that urethra originates from ostium urethrae internum, inside of the bladder, and ends in ostium urethrae externum on the distal end of penis. But more exactly, we could say that in distal part of corpus spongiosum penis, which is located centrally and from inferior surface of the penis. So, and now the next question. Parts of the male urethra in sagittal section. Practically, we can discuss the same in another picture in sagittal section. We shall use this picture. Again, first arrow is ostium urethrae internum. Here it is. Second arrow is pars prostatica urethrae. Here it is, prostate. Then pars membranacea urethra. Here it is. Urogenital membrane, which serves for regulation of process of urination, of micturition, because this is skeletal muscle. So, can you explain me if it's skeletal muscle? Will be the process of regulation by this muscle voluntary or involuntary? Sure, voluntary. So, regulation of micturition here and here in the neck of the bladder and in prostate will be involuntary, like in small child or in not training pets, but in adult or in adult men and in adult pets which are trained, the regulation of micturition is voluntary due to this sphincter, due to this muscle. So pars membranacea urethra is membrane with skeletal muscle. That's why voluntary regulation of the micturition through this muscle. And then pars spongiosa urethra. Pars spongiosa urethra. Here it is, pars spongiosa urethra. We can see that pars spongiosa is located from inferior side of the penis, not here, but close to inferior surface of it. Pars spongiosa urethra. And again, the ostium urethrae externum. Here it is on the end, distal end of the penis or distal end of corpus spongiosum. It's interestingly that here corpus spongiosum has a special widened part which called glans penis. Glans penis. And inside of it there is a special widened of male urethra. So it's very important detail which we should know, because it's important for some surgical operation concerning to catheterization of the bladder. And now, next question. Sphincters of the male urethra. Sphincters of the male urethra. There are 3 sphincters. Let's begin from the upper, most internally located. Here it is, musculus sphincter urethrae internum. Sphincter urethrae internum. We can say that it is similar to another term, sphincter vesicae. It's the same. We can say that first sphincter from smooth muscle is inside of the wall of the bladder. Here, inside of the wall of the bladder, it means the region of the bladder which we call neck of the bladder. So this muscle is smooth and involuntary. When bladder is full, so this sphincter is relaxed. Involuntary. Next sphincter is opposite to it, musculus sphincter urethrae externum. Where is it located? It's located here, inside of the urogenital membrane, from striated muscle. It's voluntary, we already said. It's interestingly that, for example, if we try to close this part of penis and scrotum, so we can say that these 2 sphincters are the same in male and female. So sphincter urethrae internum and sphincter urethrae externum, both they take place in female and male in the same points, here and here. But in male also we have additional 3rd sphincter which is absent in female. It's here, musculus sphincter prostate. Musculus sphincter prostate. Musculus sphincter prostate has also smooth muscle and it's also involuntary. Musculus sphincter prostate is involuntary sphincter. So 3 sphincters. 2 voluntary, which relaxed when bladder is full, and 1 voluntary, which really regulates the process of micturition. And let me ask you, have male organism any sphincters inside of the penis? Yes or no? No. Only 1 correct answer. No. Inside of this most long part of urethra, no 1 sphincters we can find. No 1. There is no sphincter here, inside of the glans penis. There is no sphincter here. There is no sphincter here. Only in the outlet of the pelvis. After outlet of the pelvis, there is no any sphincters. There are no any smooth or striated muscles around the urethra. So 3 sphincters in male. You know, we learn normal anatomy. But why we learn normal anatomy? To explain the problems which can take place in individuals during the different periods of life. And you know, the problem of old persons, of elderly men, is problems with micturition. So it's difficult for old men to have good regulated micturition, and it's due to prostate as a gland usually enlarging it in this region, and it prevents, no, not prevents, but how can we say that it make more difficult natural process of micturition. It becomes more difficult. And oppositely, in female, because there are no this intermediate sphincter, in female there are a lot of problems, opposite problems with micturition. It's difficult to hold urine. So it could be very often the process of uncontrolled urination, when the woman coughing, when any process of holding any heavy subjects, and so on, so on. So sphincters of urethra are very important structures which are necessary for good regulation of the micturition, and this is a quality of the good of the life. So we have now this good functioning sphincters, and very often elderly men use the pampers like in early childhood. You should agree with me that it isn't good quality of the life. Next question, structure of the testes. We already have said that testis is the main reproductive organ, because it's both organ of external and internal secretion. And here it is, the picture, and let us try to find all the details. Number one here is testis itself, or in Greek orchis. From this term we know orchitis as inflammation of the testis. Orchis, testis or orchis. Then number two, number 2, excuse me, is Caput Epididymis. Here it is Caput Epididymis. It's very important to understand that now we are looking from posterior view. So the cords were cutted from posterior surface, and after cutting, after it have been cutted, so we can see number 2 Caput Epididymis, then number 3 Corpus Epididymis, and number 4 Cauda Epididymis. Be attentive. Caput Epididymis is quite large. Corpus Epididymis is smaller than caput, and Cauda Epididymis is very thin, is most smaller. So, like sign of comma, caput is large, corpus smaller, and the most smaller is the smallest is Cauda Epididymis. Then number 6, very interesting structure, that this is Appendix Testes, and similar Appendix Epididymis number 7. They are rudimental remnants from embryonic developments. And then number 8, one of the cords, so named Tunica vaginalis testis. This is a remnant of the peritoneum. We remember that testis was developed in intrauterine period very high in the abdomen, in the posterior wall of the abdomen, on the close to the kidneys. That's why peritoneum, which had place inside of the abdomen, so it was also migrated here. And number 8, Tunica vaginalis testis, is the migrated part of peritoneum. Practically, it's also serous sheath, and that's why we can say that there are 3 serous sheaths in female. They are pericardium, they are pleura, and peritoneum, and 4 serous sheaths in male: pleura, pericardium, peritoneum, and tunica vaginalis testis. Here it is number 8, tunica vaginalis testis. And then number 9, fascia spermatica interna, the cord which covered both testes, and also spermatic cord, fascia spermatica interna, which is a remnant of fascia transversalis abdominis, fascia transversalis abdominis. And number 9, the last designation, is skeletal or striated muscles, musculus cremaster. It's very interesting that in many species of the animals, in adult period of life is possible for these male animals to elevate the testes from scrotum inside of the abdominal cavity. And it was also possible for female child's first weeks of postnatal period, but after 2 or 3 weeks it became impossible. So in adult male is impossible to elevate the testes from scrotum to abdominal cavity. But this muscle really serves for this reason in another species of the animals. So let's prolong this question on another side, and exactly question is coats of the testes. Coats of the testes. Coats, and according to them, layers of anterior abdominal wall. We can say that inguinal canal exists in men only after 5th month of intrauterine development. Before 5th month, the testes were located in lumbar region, and from abdominal cavity there were no any canals which connects abdominal cavity with external part of the body. So that's why during process of descensus testis, it means migration testis, all layers of abdominal wall, they form the coats of the testis. That's why we should know each coat and corresponding to it coats or layers of abdominal wall. Number 1, we are begin from externally. Number 1 is cutis. Number 2, tunica dartos. Tunica dartos. We can say it's panniculus adiposus of anterior abdominal wall. Tunica dartos practically is the same as panniculus adiposus of anterior abdominal wall. Then number 3, fascia spermatica externa. Number 3 is fascia spermatica externa. It corresponds to fascia abdominis superficialis. Fascia spermatica externa practically is the same like fascia abdominis superficialis. Then fascia cremasterica. It corresponds to fascia abdominis propria. And then musculus crevaster, which corresponds to musculus transversus abdominis. So musculus cremaster and musculus transversus abdominis are practically the same muscular structures. Number 6, fascia spermatica interna. One of the most important, because really this fascia has surrounds the testis and also it surrounds the spermatic cord. So it isn't only cord of the testis, but also cord of spermatic cord. And then tunica vaginalis testis, which consists of two laminas, lamina parietalis and lamina visceralis. All two laminas are located in the region of sinus epididymis, on the outer surface of the testis. And we can say that tunica vaginalis is equal to the peritoneum. Peritoneum and tunica vaginalis testis practically are the same structures. And again, tunica albugina. Tunica albugina. Tunica albugina is, you can say, capsule of the testis. If we shall cut it, the seminiferous canals, seminiferous tubules will be seen inside of this cord or behind of this cord. So we can say there are 7 cords, and tunica albugina is some kind of capsule of the testis. And now let us make a section, longitudinal section of the testis. So, number 1 is surnamed Plexus pampiniformis in funiculus spermaticus. So we can say that this is funiculus spermaticus, which held the testis. Inside of it, there are numerous venous blood vessels, which called Plexus pampiniformis. Because man is standing animal, so that's why there is a risk of widening, of extension of these plexuses and forming so-named varicocele. Varicocele is the disease which is resulted from widening, from extension of Plexus pampiniformis. It isn't good because we have already said that testes are located inside of the scrotum due to necessity to have a temperature low on 1 or 2 degrees than temperature of the body for spermatogenesis. And if there are varicocele, varicose, extension of the venous blood vessels, so it will be resulted in the warming of the testis and the problems with normal spermatogenesis. So, result of such kind of warming is problems with fertilization, ability to fertilize the oocyte. Then number 2, it's in section Caput Epididymis. So you can see that there are a lot of small tubular structures inside of it. Then number 3, Tunica albugine. Here it is, the capsule of the testis. From it we can see there are septula testis as radial structures directed to the posterior surface of the testis. Septula testis is structures from connective tissues which divides testis to different parts, and they are small parts of the testis. Usually there are from 12 to 20 lobuli testis. Number 5 is lobuli testis, the parts of parenchyma of the testis between these septulae. Number 6 is cauda epididymis, and number 7, very interesting structure, here it is number 7, is mediastinum testis. Mediastinum testis is the posteriorly located part of the testis where there are a lot of blood vessels and where all tubules, seminiferous tubules, they connect here together in special network, in special mesh. So this common structure. And now question concerning the content of spermatic cord. Content of spermatic cord. So most important internal structure of spermatic cord is ductus deferens. Then, together with ductus deferens, there are numerous blood vessels, exactly. Arteria testicularis, which is outgoing from aorta, arteria testicularis, for nourishing of testis. Then arteria vena differentialis for nourishing the ductus deferens. Then arteria cremasterica, which is necessary for nourishing musculus cremaster. That was arteria and corresponding to them veins, but some of veins had another name, so named Plexus pampiniformis, venous plexus. You can see in previous position we said arteria testicularis, but not vein. Vena testicularis, it wasn't written because instead of vena testicularis we have plexus venous pampiniformis, from which vena testicularis forms more highly, more superiorly. Vena testicularis falls in the vena cava inferior at the right, and on the left it falls into the left renal vein, And also we can find there numerous lymphatic vessels and number 5, nerves. According to the nerves, there are plexus sympathicus differentialis, so named, and plexus sympathicus testicularis. Plexus sympathicus differentialis and plexus sympathicus testicularis. And also we can say that inside of spermatic cord there is a remnant of vaginal process of the peritoneum and the loose fiber which bind all these elements. You know, remnant of vaginal process is a very important structure because due to it is possible to form in pathological situation as inguinal indirect hernia. Inguinal indirect hernia. And now the same question, the content of the spermatic cord and its coats in the picture. So let's together to make a large picture. So use please 1/2 of the paper to draw it. So number 1, fascia spermatica externa. We are going from external surface to internal, from out to inside. So number 1 is fascia spermatica externa, most externally located fascia. Then more internally, number 2, musculus cremaster plus fascia cremasterica. Why we use both of them together as a dotted line with changing red and green color? Why? Because musculus cremaster consists of from different fibers. Between of them you can find fascia cremasterica. The green is fascia cremasterica, which connects different fibers together. Then more closely, number 3 is fascia spermatica interna. Number 3 is fascia spermatica interna. Then the content of the spermatic cord, the main content is the structure number 4. Number 4, what is it? Ductus deferens. The transporting tubule which serves to transport the semen from testes to urethra, and it's quite clear that it has very thick wall. If you try to palpate the spermatic cord, it has very strong wall, very dense wall, due to good developed muscle. So that's why ejaculation could be in large distance from the ostium urethra externum, because this muscle is very strong. Then around this ductus deferens there are number 5, a lot of plexus sympathicus differentialis, a lot of nerves which belongs to number 5 plexus sympathicus differentialis. So they are nerves for regulating of this process of contraction, ductus deferens. close to it, we can find number 6. What is it? Number 6. It's Arteria deferentialis. Arteria which is nourishing the wall of Ductus deferens. Ductus deferens is quite long structure, about 15 or 20 or 25 centimeters. It depends from constitutional features, but sure, it's necessary to nourish it for making this possibility to contract it. So, arteria deferentialis makes this function. Number 7 is arteria testicularis. Number 7 is arteria testicularis. And it is surrounded by numerous nerves. Number 8 nerves are plexus sympathicus testicularis. Number 8 is plexus sympathicus testicularis. And this free space, what we can find in this free space? Practically there are no any free spaces in our organism, so it would be occupied by any structures, and we can find here a lot of venous vessels. Number 9 is plexus pampiniformis. Plexus pampiniformis. Plexus pampiniformis we already have said it could be extended and form numerous varicosities that call the disease as varicocele. Varicocele is disease of pathological extension of plexus pampiniformis. And number 10, this is a remnant in Russian. It's written a remnant of tunica vaginalis testis. A remnant of tunica vaginalis testis. So processus vaginalis testis. And number 11, nervus genitofemoralis, ramus genitalis. Number 11, nervus genitofemoralis, ramus genitalis. So, may I ask you, nervus genitofemoralis is located inside of the spermatic cord or outside of it? Sure. Right or correct answer should be outside. That's why we can demonstrate it in our cadaveric specimen in classroom number 3. Try to find it. It is good seen there. Now, question which we already know from previous semester. What is the spermatic cord? The definition is spermatic cord of funiculus spermaticus is ductus deferens accompanied by blood vessels and nerves. So, ductus deferens accompanied by the blood vessels and nerves. it is surrounded by the internal spermatic fascia spermatica interna, and this fascia is continuation of the transverse abdominal fascia. So I use this arrow to demonstrate that from left side, this is right side because we are looking from posterior view. From right side we can see Ductus Deferens. This is Ductus Deferens. But from opposite side we can see the spermatic cord. This is Ductus Deferens, very thin, and this is spermatic cord, quite thick, and which contains a lot of structures. And another several specimens for demonstrating these relationships. Here it is number one, spermatic cord. This is also number one spermatic cord, and this is what is inside of it after it was cutted. So you can see a lot of structures. Vessels, Ductus Deferens, number 14, and nerves. And now testicular vessels and vessels of spermatic cord. You can see arteria et vena testicularis. You can see plexus pampiniformis of blue color. You can see Ductus Deferens, here it is, together with arteria deferentialis, arteria and vena ductus deferens or deferentialis. You can see arteria cremasterica, and all they are contents of the spermatic cord. And next very important question is seminiferous tracts. This is the picture on the blackboard, but now we shall not do the same. You shall try, make the pause and try to draw it. Be attentive that this is the inguinal canal and try to understand all the designations. But now we shall do practically the same, the similar pictures together. But before this, I'd like to demonstrate you the transverse section of penis, which was made this way. So if we make the transverse section of penis, so we can find to CC corpora cavernosa, corpus cavernosum dextrum, corpus cavernosum sinistrum. Inside of each of them there are arterias, and here from inferior position we can see CS corpus spongiosus. Inside of it we can find a urethra masculinum, and this is very important veins which are important in the process of erection. The vena dorsalis penis. And now seminiferous tracts in this picture. We can see which way numerous seminiferous tubules are arranged, and let's try to do this picture together. Again, use the free sheet in your notebook, and let's draw it together. So this is the Capitated Testes, and inside of it we can find numerous parallel to each other structures which we shall designate as number 1. Here it is number 1. What is it? It's tubulus seminiferi contorti. One is tubulus, but there are a lot of them. Tubuli seminiferi contorti. It's place of formation of spermatozoa. So it isn't transporting system, but it's system of formation of spermatozoa, development of them. And after we can find a transporting system. Here they are. If number 1 was tubuli seminiferi contorti, it means quite as sinusoid changed its direction. So number 2 is tubuli seminiferi recti. They're quite straight, and direction of them is to the posterior surface of the testis. Tubuli seminiferi recti, number 2. Then next part is number 3, so named rete testis. It's written in Russian. It's localized in the mediastinum of testis. In mediastinum of testis. So here it is mediastinum testis, inside of each of which take place rete testis. These structures were inside of the testis, and now several another canals which are outside of the testis. Outside of the testis, but inside of the epididymis. So these several ductuli, number 4, they are ductuli efferentes testis. Usually there are about 10 of such kind of structures, sometimes 10, sometimes 12, but not very numerous. Ductuli efferentes testis. You can see that they directed superiorly, from mediastinum superiorly, and then in opposite direction, inferiorly. Only one structure, number 5. What is it? It's Ductus Epididymis. Number 5 is Ductus Epididymis. And then number 6 is Ductus Deferens. I'd like you pay attention that there is always changement of direction. Number 4, ductuli efferentes moves up from central part of the testis superiorly. The number 5 moves down from caput epididymis to the cauda. And again, number 6, ductus deferens, they moves again up from the cauda epididymis to the inguinal canal. Now we can make the designation of epididymis. I already have said that epididymis is similar to the sign of the comma, because caput is quite large, and then corpus and tail becomes thin. So we can compare it with the sign of the comma. It is very important picture which you should know. So we tried to organize this lecture by using several very important questions which you ought to know by heart and which we shall use in our electronic tests. So be attentive to this material. So we finish our lecture, and you can make a pause 10 minutes. Thank you.